There are inherent risks for all operations, including surgery on your neck. What I like to do is to make sure that my patients at least understand the grand majority of those. And they include but are not limited to the following. There's a risk of bleeding, infection, stroke, or death. I want to go back to those. My average blood loss is less than 1 ounce. I've never had to give a transfusion in my career, and I'm very grateful for that. The risk of an infection is probably less than 3% nationally speaking, but if one gets an infection, it's a very big complication. The risk of stroke or death has more to do with your own general physiology. For example, whether or not your heart and lungs are in good condition. I will communicate with my anesthesia colleagues to make sure that you're safe in that regards. Other risks have more to do with the actual anatomy of what I'm doing. For example, there's a risk of me damaging your spinal cord. That's the biggest risk of all. And if that occurs, I can cause you to lose all bowel, bladder, sexual function, all movement below your neck. Now, I've never caused that, but it can occur. Also, I could damage the nerve root, actually either nerve root on either side. Even though your problems might be on the left, I will always do left and right side, so I could damage either side. And if I do, I can cause permanent numbness, tingling, or weakness down the arm. Other risks include a swallowing problem, very small risk. After my surgery, I had difficulty swallowing, and to this day, I don't swallow normally, but I can get it done. The other risks include instability. For example, if your bones don't grow together properly, if they don't fuse properly, we may have to repeat that part of the surgery. In a non-smoking, relatively young person, the risk of that is certainly less than 1 or 2%. In a smoker, the risk of non-union goes up dramatically. The plate, the screw system, and some of the things that we have available to us in the operating room now compensate for that to a degree, but always a smoker has a lower fusion rate than a non-smoker. The last potential risk that I like to make sure that my patients understand is a risk of hoarseness of the voice. That's not from damaging the vocal cord, but the nerve that goes to the vocal cord can be stretched. 15% of the time, people wake up with a certain level of hoarseness. Now, that might be from the endotracheal tube, and it might be due to stretching that nerve. But only 1% of people or less have a permanent voice change as things heal.